Grady Health System is a large public safety net academic medical center centered in downtown Atlanta. Our mission is to provide care to all the patients of Fulton and DeKalb County and the surrounding Atlanta metro area.
It's really very important that the staff are well equipped to take care of older adults that come to Grady for various comorbidities, but there's a need to also address the geriatric syndromes that are associated with those comorbidities. I think it's been amazing for us. I think that participating in the collaborative and that effort to disseminate the age-friendly work here has increased the awareness of the staff. This has been a process of creating that awareness and also equipping them with skills to care for older adults to improve outcomes.
So I remember a patient, she came in with pain, right? And she had a fall and she was just sitting in the bed and looking like super sad. I was like, what would you like to do today? A few hours later, she had no pain, so we got her up in a chair. Over a course of days in her stay, physical therapy worked with her. Her original prognosis and destination was for her to go to like this skilled nursing home. Long and behold, she was able to actually go to rehab and go to home. Only thing she wanted to do was get out of bed, sit in the chair with no pain, and we made it happen.
So I met this patient one morning. He was asking if he could come in the hallway, and I'm like, I'm not pretty sure. Let me follow up with PT to see if we can do that. So we followed up with PT. They cleared the patient, so we put him in the Jerry chair, sit at the nurse's station. So we got a translator to come through, and then they found out that he wants to work for the organization. And I was like, you want to work here?
We've been implementing the 4 M's on our unit, and one of those is asking every day, what matters to you? What is your goal today? What do you want to get out of today? It's amazing how a simple question of asking what matters can make such a huge difference for this patient population.
Age-friendly care is very rewarding. It goes beyond the age, the diagnosis of the patient. We want to make sure that we treat the patient holistically. As a nurse, it does assist with burnout. You're not easily burned out because we're looking through a different lens. We're looking through the lens of the patient to make sure that we're assisting them, caring for them, tending to their needs personally and health-wise to ensure that their care is taken care of.
So what I've noticed is it's kind of helped everyone slow down a little bit. You know, there's not much, what do we call that? Assembly line care. I actually see a lot of TLC care, which I call tender loving care. You can actually take your time, be patient with them, help graze, and actually listen to them. You actually get a chance to experience the patient and really figure out what matters to them.
We recently went through our health equity certification through the Joint Commission here at Grady. When the surveyor was on site, he wanted to visit one of our age-friendly units. He was really impressed with what he saw. He saw staff engaging with our older adults, regardless of their abilities. He saw staff mobilizing patients, even though they had limited mobility. And he saw staff engaging folks in mentation, despite their cognitive challenges. He was able to see how our unit leader, Sika, regularly rounds on all of her patients, knows their needs, knows what matters to them, and makes sure that her staff delivers it regularly.
Knowing what these patients need specifically and tailoring our care towards this age-friendly care that we're able to give them, speaking up for them, being that voice and advocating for them is the most important and most prideful aspect of my job.
So since joining IHI's collaborative, we have spread to 4 inpatient units in the hospital. We've also spread to all of our primary care clinics and our long-term care facility. So by September, I'm proud to say we will have spread to 11 inpatient units, which totals 404 beds for our patients. So by the end of 2025, we will have started our spread into our first specialty units. We are going to have 4 M's care in our congestive heart failure unit, our cardiac step-down unit, and our dedicated education unit. And then next year in 2026, we have big plans to spread 4M's care into our specialty clinics and our surgical clinics. And we plan on topping off 2026 with our geriatric surgery verification.
So when we find the cheerleaders for this, those were the people who galvanized and said, come on, you need to tell other people the importance of this. So now we are across most of the units have been educated. It's about providing resources and for them to understand this is part of your workflow. It doesn't add any more work to you because you're still going in the room, you're still talking to the patient.
For my nurses, I would just say stay with the process. Sometimes it is challenging, but when we're looking through those different lenses, the burnout is way less. Those challenges aren't as obvious because you're doing it with a compassionate heart, kindness, and with the framework, which is the foundation of the care.
And we knew that 4M's care was what our patients deserved, and we knew that it was important to us, and we knew that it had a home at Grady. And being part of the collaborative has provided us with the tools, the mindset, and the know-how to make this matter to other people. And because of that, we've been able to successfully spread it and see the impact of it. And the sky's the limit for us, and our patients benefit through it all the while long.